What does the heart look like?
Your heart works like a pump. It has two sides that are separated by a muscular wall called the septum. The right side, called the right ventricle, fills with blood that is low in oxygen. This blood comes from veins that carry blood from your body to your heart. The right side of your heart then pumps this blood to your lungs to pick up oxygen. The left side of your heart, called the left ventricle, receives this oxygen-rich blood from your lungs and pumps it back to your body through your arteries.
What happens during heart failure?
Heart failure happens when your heart cannot pump blood as well as it should to meet the needs of your body. There are many reasons why heart failure can happen, but when your heart has trouble pumping blood, there is a buildup of blood coming to the heart from the rest of the body. This buildup of blood can cause shortness of breath if it backs up into your lungs. If blood backs up into your body, this may cause swelling of your belly or legs. Even with the best treatment for your heart failure, in time your heart may become so weak, the medication that may have made you feel better in the past will not make you feel better now. This is when the left ventricular assisted device, or LVAD, may be a treatment option that is right for you.
What is an LVAD?
A left ventricular assist device, or LVAD, is a mechanical pump. An LVAD can be attached to your heart to take over the work of your left ventricle and pump blood to your body. The LVAD is made up of 4 parts: a blood pump, a drive line, a system controller, and a power source. The blood pump will be connected from the tip of your heart to your aorta, the main artery leaving your heart. A cable with electrical wires, called a drive line, connects to the system controller to the LVAD. The drive line sends signals and electricity to your LVAD to keep it working. The drive line exits the body just above the waist on the right or left side. To operate your LVAD, you will need a system controller, which is a small computer that tells your pump what to do. It has a built-in power source. Your system controller can be worn in a bag over your shoulder or on your belt. It will be easy for you to see how your LVAD is working by pressing a button on your system controller. Warning lights and sounds will let you know if there are problems with your LVAD. Your LVAD will be powered using batteries or electricity from a wall outlet.
What will happen after my LVAD operation?
Your LVAD operation will take 4 to 6 hours. The first incision will be made at the top center of your chest or breastbone down to your stomach area. A second small incision will be made in your abdomen near your stomach. This is where your LVAD driveline cable will exit your body. Your LVAD will be placed inside your chest near your stomach. During your operation, a heart-lung bypass machine may be needed to take over the function of your heart and lung while your surgeon is placing your LVAD. Your need for a heart-lung bypass machine will depend on your condition, the type of LVAD you're getting, and how well your heart will be able to pump during your operation. Once your heart is pumping with the help of your new LVAD, the heart-lung bypass machine will be stopped. Once your LVAD is connected to the system controller, it will take over pumping for your heart. If you needed a heart-lung bypass machine during your operation, it will be stopped and your LVAD will take over. Your surgeon will close your incision and cover it with a bandage.
When will I go home?
After your operation, You will be brought to the cardiovascular intensive care unit, also known as the CVICU. A breathing machine, or ventilator, will help you breathe until you're strong enough to breathe on your own. You will see tubes and IV lines that were put in during your operation. They will be removed when you get better. You will also see a driveline cable exit your body in your abdomen near your stomach. Everyone recovers differently after an LVAD operation. Some people may recover in as little as 3 days. Others may take longer than 7 days. You should expect to feel weaker after your operation for a little while as you recover. When you are ready to move out of the CVICU, you will be taken to the cardiovascular ward. Once you leave the CVICU, your goal will be to get better and start to feel stronger. You can do this by taking part in your care and taking time to know as much as you can about your health. At the cardiovascular ward, your healthcare team will help you and your family or caregivers learn how to use and care for your LVAD. At least one of your family members or caregivers needs to know how to operate your LVAD device before you can go home. It is important for you to take part in your rehabilitation plan after your LVAD operation. Your healthcare team will help you to walk and do deep breathing and coughing exercises. Learn about your medications and learn how to manage living with your LVAD. Take part in your care and talk with your healthcare team if you have any questions or concerns.
When will I go home?
Depending on your condition, your healthcare team will decide with you if you can go home in about 2 to 4 weeks after your LVAD operation. Before you go home, your healthcare team will make sure that you have the equipment you need to take care of yourself and your LVAD. After you leave the ICU, your goal will be to feel better by participating in your health.
What should I think about when living with an LVAD?
Getting an LVAD is a chance for a better life. But getting an LVAD means a big lifestyle change for you, so it is normal to feel concerned. Your family and your healthcare team, including your doctors, nurses, dietitians, physiotherapists, social workers, and your psychosocial support team, will be there to help you adjust and live a full life. There are many ways that your life will improve after getting an LVAD. Your LVAD will help improve your blood flow through your body. This may help your liver and kidneys to work better. You may also do activities that you were not able to do when you were very sick with heart failure. There are a few precautions that you will need to take with your LVAD. You will still need to take medication. In addition, you will need to take anticoagulants such as aspirin or Coumadin while you have an LVAD. After your incision for your driveline heals, a shower may be possible. Talk about this with your healthcare team. Your healthcare team will tell you when you may start showering. Do not take a bath, swim, or go underwater with your LVAD. Eat as you did before your LVAD operation as long as you do not feel any discomfort. Vitamin K affects how well blood thinner medications like Coumadin work. Try to eat about the same amount of vegetables that contain vitamin K each day to help your healthcare team adjust your Coumadin dose. Wait for your surgical wound to fully heal before having sex. Women with an LVAD will need to take precautions by using condoms and foam to avoid pregnancy. Avoid contact sports like soccer or football because you may damage your LVAD or electrical driveline. Take extreme care with your driveline cables. Your driveline sends signals and electricity to your LVAD, so any damage to your driveline could be life-threatening. Watch your system controller and listen for any alarms. Your healthcare team will tell you which serious signs and symptoms to look out for and when you will need to go to the nearest emergency room. Look for any signs of infection like redness, swelling, or pus at the spot where your LVAD driveline comes out of your skin. Talk to your healthcare team right away if you have any signs of infection or if you notice any new changes.
How long can an LVAD support me?
Most people can be supported using an LVAD for years. Some people have been supported using an LVAD for up to 7 years. If you and your family have any questions, talk to your healthcare team.